Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the SI joint. It is Gaenslen's test. So this test was spoken about first in a paper in 1927 by Dr. Frederick Gaenslen. And so in this paper, he was just discussing ways to determine if a patient needed SI joint surgery. So he was saying that there was too many people having these surgeries and that they were unnecessary and that they should really only be reserved for people with like chronic pain or instability. And so he said, let's just make sure that we select people very well who would benefit the most from it. So he went through this and was talking about there's ways to determine if somebody needed it. So things like a localized pain, pain with weight bearing, failure with conservative treatment. So he was looking at these provocation tests very, very early for it. So he came up with some specific things like pain with weight bearing or standing, walking, or with like an asymmetrical motion, which we're going to get into right now. To perform this test, you have the person lying on their back. You want them to scoot over to the edge of the table because you need to move this leg that's towards you. What you want to do, the opposite side, you have them bring their knee up toward their chest and they can hang onto it. The other side, you bring off of the table where it's hanging down. Then what you do is you apply an overpressure into that flexion on the opposite side and an extension on the side towards you, a little overpressure into that. And if the person has a production of pain symptoms, in the downside, so the side that the leg is down, it is considered a positive. In getting in on the research for this test, I just want to preface this. One thing when you get into the SI joint is that often when you look at these papers, they don't look at just one. They look at a group of them. They will do a cluster. They will do several of them in these tests, in these papers. Also, they will use injections as like a gold standard. So what they would do, people have SI joint pain or suspected SI joint pain. Let's do these tests on them, mark down who's positive, who's negative. We go do an injection, and if they got better with the injection, that meant that they had an SI joint issue, and the ones that were positive predicted it, and the ones that were negative didn't. So we have to keep that in mind when we're looking at some of these papers. Now, there are a couple of them that talk about the sensitivity and specificity of this test. There's one back in 2005, which is funny to say that, by Mark Gaenslen, and he's known for doing a lot of research with the SI joint. And so he looked at 48 people and he was comparing 6 tests. So it was distraction, compression, thigh thrust, sacral thrust, and Gaenslen. He was always comparing that to the injection. Now, you may say, like, well, Matt, that was only 5 of them, but the Gaenslen's he was looking at on both sides. So with Gaenslen's, he found that of these people that, again, the left and right side, they were pretty comparable on it. So 31% of the people had it, so they were positive on the left, and 37% on the right. So that came up with the sensitivity of the left and right. So the sensitivity was 50% on the left and 53 on the right, with the specificity of 77 on the left and 71 on the right. Now, also he did say, again, in that paper, looking at all these tests, he's like, if all 6 of those tests are negative, then it's most likely they don't have an SI joint issue, so keep that in mind. Now, more recently, they did another research on it. So kind of the same thing. It was in 2020. They looked at 48 people, and they looked at, again, clusters of tests as well, several of them in there. And they found this one that the sensitivity went up. So sensitivity is at 74%, but the specificity dropped. It dropped down to 33% on it. So one says that the sensitivity is higher and the specificity is lower, but the other one says the sensitivity is higher and the specificity is lower. So very, very interesting on it. But they said that, again, for both of these, that if like 3 or more tests are positive and you have like some motion like differences with palpation, it's most likely the SI joint. So anyway, I just want to talk about that and just bring this test back and talk about it. Let me know, do you use it? Do you like it? Do you think it's valid? Let us know down in the comments below. And as Mateo always says, take care of yourself. Take care of your patients. We'll see you next time.